My name is Brian Packard. I'm the facilities manager for Graves Gilbert Clinic. Our greeter services are at the front door. We have, it started very modestly back when this building, our main clinic building, was first constructed and we occupied it. Our maintenance staff really didn't have a lot to do. It was a brand new building. Once the initial hiccups are kind of worked out, you don't really have a lot of things to busy your time with. And so our administrator at the time saw that and realized there was an opportunity to have them stand at the front door and just say hi to patients, be friendly to them as they come and go. And so through the years, first couple of years, that was fine. They had time to do so. But as the building got some age and some wear and they started getting pulled away half day at a time to go work on things, the front door would be unmanned. And so those patients who got accustomed to someone helping them in and out and helping them with wheelchairs and, hearing how their office visit went, those kind of things, that all the intangibles of what they do, when those things weren't in place, they came up for air and said, hey, where's that greeter? It used to be at the front door. And so they didn't realize it was a maintenance guy. That's what they didn't realize. So that's how it developed. That's how the position came to be. For us, that was the light bulb moment. Wow, we really need to offer more than just a receptionist at the front desk. We need to have someone permanently in that place, that position, to greet them, not just say hi, but to help them in and out of the building. So there are a lot of things that you don't get to see that the greeters do. People just think them shaking a hand or waving hi or saying bye to somebody, but we have a lot of patients who come regularly, be it for physical therapy or chemotherapy or a variety of things that are ongoing treatments. And they get used to seeing those same people and having conversations. They get to know them. And one of the things that I think is really interesting is the stories that they get. They have to be good listeners. Probably above all else, they have to be good listeners. So the greeters become every bit as much a part of their care, if you will, as the providers, as the physicians, the nursing staff. When they leave an appointment, sometimes people who've gotten to know the greeters, they may have just learned something that's heavy on their mind. And so while they're waiting for their ride or waiting for someone to come help them, they'll share information. They feel like they know that person, and they do know that person. So that piece of what they do, I don't think it's seen unless you're that patient who comes in frequently. You don't realize that even happens, but they definitely establish relationships with the patients and vice versa. I guess if you had to pick one word, it'd be caring. The same thing I described in what the greeters offer, that ear that is a compassionate ear to hear what's going on in that person's life or what they may have just learned about their health, is the same thing that I think patients from the very beginning have become accustomed to with Graves Gilbert. It's not just a medical office visit, it's your provider, it's your caregiver who's going to take care of you and listen to you and wants what's best for you, truly tries to do what's in your best interest. I've been with the clinic for 23 years, and it's a family. It's a family for me. It has been since probably the first year in. I felt like I was part of something that I've never felt in a job that I was. The people that I work with care about one another. We care about each other and support each other, and I think when you have that environment, that culture in a place where people truly enjoy working with another, it just naturally, I think, gets transferred to the patient care as well. So I think a lot of patients see us as family. They don't just see us as that doctor, again, or that provider. They see us as family.